2, 1.
Bridging the treatment gap and addressing the existing barriers to accessing mental health services is what lies at the forefront of the newly unveiled 21-bed mental health ward at Hani Baragwanath Hospital. The new ward will now service patients previously deprived of a psychiatric admission ward and will bring much needed relief to the hospital, which sees an influx of people presenting with mental health disorders in Soweto and surrounding areas.
Now we are going to bring dignity to our patients, because from now onwards, once they get assessed a casualty, we're going to move them to this unit, to this acute unit, where we'll finish off our psychiatric assessments. Remember, at casualty they do the medical assessment. Now here we'll do our psychiatric assessments.
The absence of a psychiatric admission ward placed immense pressure on other wards. As a result, the overcrowding at the hospital's accident and emergency unit, which was used by the mental health care patients waiting for admission, will now be a thing of the past.
This one is at most 72 hours. And this is to support, so that if the patient is a crisis in the community and acute assessment and stabilization is required, the patient can come here so that we relieve the districts and the clinics. And once we stabilize the patient can then go and follow up closer to their communities.
Meanwhile, chronic underfunding continues to widen the gap to accessing mental health services. This has undermined efforts to ensuring people get adequate quality mental health services across the country.
We know in South Africa that the mental health space, especially treatment in the public sector, is heavily underfunded. And the facility that we assisted and partnered with the Hani Baragwanath Academic Hospital to renovate and to really, it's such a beautiful facility that we've established.
While increasing access to mental health services is indicative of progress for South Africa, the prioritization of human rights and dignity of patients alongside adequate funding is critical in bringing mental health services closer to the people that need it most. Zandile Myeza, SABC News, Johannesburg.